All right, let's talk about the great American healthcare puzzle. It's something that affects every single one of us. It's a system that somehow costs way more and delivers way less than pretty much any other wealthy nation on earth. And today, we're not just going to look at why it's so broken, we're going to explore a really radical idea for how to fix it.
So let's just dive right in with the central question, the one that honestly keeps experts up at night. How is it possible that the United States, the wealthiest country in the world, spends more money on healthcare than anyone else, but ends up with people who are sicker and die younger than in other comparable nations? It just doesn't add up. And look, when we say we spend more, we're not talking about a little bit more. Get a load of this chart. The US is a massive, massive outlier. It's not just a gap, it's a chasm. We are literally off the charts. You can see this is the financial black hole, right at the center of the whole system.
Okay, so you'd think all that money buys us better health, right? More years of life. Well, here's the tragic flip side. All that spending doesn't buy us more time. It actually buys us less. Americans have a lower life expectancy than people in countries that spend just a fraction of what we do. So where on earth is all that money going?
Well, here's a huge piece of the puzzle. A giant slice of our healthcare spending, it never even gets to a patient. It's just devoured by this monstrously complicated administrative machine. I mean, can you imagine? You're a doctor and you spend a third of your day not treating people but just fighting with paperwork and billing codes. The system isn't really built to deliver care. It's built to navigate a maze of insurance approvals and denials. And the human cost of all that inefficiency? It's just staggering. 530,000. That's how many times every single year an American family is pushed into financial ruin just because somebody got sick. Think about that. This isn't just some flaw in the system, it's a feature. It's a system that punishes illness with poverty. So now that we've kind of diagnosed the disease, let's talk about the prescription. And it's a pretty radical one. What if the answer isn't a better insurance plan or a cheaper one? What if the answer is getting rid of insurance for basic healthcare altogether? And this is the core idea. We stop treating healthcare like a product you have to buy and insure against, and we start treating it like a public service, something that's just there for everyone when they need it. You know, like a public library. You don't need book insurance to borrow a book. You just go get one. This idea applies that exact same logic to seeing a doctor. So how would you even get there? Well, when you break it down, the path looks something like this. Step 1, you make private health insurance for medically necessary stuff illegal. Step 2, you take all the money we're already spending on government programs like Medicare, Medicaid, the VA, and you pool it all into one big unified fund. And step 3, you just open the doors to everyone who lives here. It's a simple vision, but a really powerful one. Okay, so what would actually happen if we did this? What's the payoff? Well, it's not just about better health. The projections show a seismic shift for the entire U.S. economy. Get this, instantly, over $1 trillion a year is freed up. And that's not government money. That's money from insurance premiums that goes straight back into the pockets of regular workers and onto the balance sheets of businesses big and small. It's like one of the biggest tax cuts and economic boosts you could possibly imagine. And remember that devastating medical bankruptcy number? Well, just like that, the engine that creates all that debt gets shut down. We're talking about hundreds of billions of dollars in debt that crushes families and drags down our economy. It would just stop happening, year after year.
The ripple effects from there would be enormous. Think about job lock. You know when you're stuck in a job you hate just because you're terrified of losing your health benefits? With universal care, that's gone. People are free to change careers, start their own business, take a risk. It unleashes a way more dynamic, entrepreneurial, and competitive economy for everybody.
But here's the ultimate prize. I mean, this is the real reason you do it. With everybody having access to care when they need it, preventive care, early treatment, we don't just save money, we save lives. Projections show we could add more than 5 years to our national life expectancy. We'd just be a healthier, more resilient nation. But okay, let's be realistic. This all sounds great, but a change this massive isn't easy. It would come with huge challenges. You can't just flip a switch on a system this big without a serious plan for the transition. So the key to making the finances work is capturing all that administrative waste we talked about. Right now, private insurers spend about 17 cents of every dollar on overhead. The current Medicare program, It spends about 2 cents. So by moving to one streamlined system, you could redirect hundreds of billions of dollars from paperwork to actual patient care. However, and this is a big however, that efficiency has a very real human cost. We're talking about nearly 1 million people who work in jobs that, well, they just wouldn't exist anymore. Any responsible plan has to address that head on. So the idea isn't to leave people behind. The plan calls for what's known as a just transition. You'd use federal programs to help retrain those 900,000 workers for the 2.3 million new healthcare jobs the system would actually create. It's a massive shift from processing claims to providing care, moving people into roles like nursing and medical coding where they are desperately needed. Okay, so we've seen the potential economic payoff, we've seen a plan for the challenges. The numbers seem to add up, the health benefits are clear. So what's the real barrier? Why is this so hard? Well, the biggest hurdle isn't logistical or financial, it's ideological. This quote really gets to the heart of the political fight. It suggests the argument isn't really about big government versus small government. The real fight is about where we want the government to intervene in our lives. And this kind of maps out the two competing visions in America. On one side, you have a social justice morality, which believes the government's main job is to provide for the group economically, things like universal health care or public education. On the other side, you have a social order morality, which believes government's job is to protect the group by regulating social behavior. The thing is, both sides want government intervention, just in totally different parts of our lives. So ultimately, this is the trade-off we face. This is the choice. Right now, we live with massive individual financial risk, the risk that you, personally, could go bankrupt because you got sick. This proposal swaps that for systemic political risk, the risk that some future Congress could decide to cut the entire nation's healthcare budget. And that brings us to the final, fundamental question. What is healthcare? Is it a product, a commodity to be bought and sold in the marketplace, like a car or a TV? Or is it a public good, like the fire department, something that a decent society guarantees for everyone? How we as a country answer that question will define not just our healthcare system, but who we are.